Welcome back, Dr. Mealy.
Thank you. Nice to be here.
We want to talk about tummy tucks today, and I guess the logical question is, what is the tuck in the tummy tuck?
The tuck is usually getting rid of both extra skin and looseness in the muscle. So actually tucking two things.
Okay, so now this is not to be taken lightly. This is
real surgery. Yep.
And you're under a general anesthetic.
Under general anesthesia that helps with the muscle repair.
Okay.
We can relax the muscle more under a general anesthetic than under a local anesthetic.
So walk me through it a little bit. I mean, who needs this sort of thing? Obviously, you know, women who've had a lot of kids, it stretches the muscles out and the skin.
Childbirth certainly is one situation where we get laxity or looseness in both the muscle and the skin. Since the child's inside, it's pushing out and stretching those areas. Massive weight loss is another area where we end up doing tummy tucks for the same reasons, both for men and for women.
Now, why doesn't simple exercise solve the problem?
Exercise is important, and it's actually an adjunct to what I do. What I'm doing is getting rid of the extra skin that just doesn't shrink, doesn't go away, and tightening the case around the muscle. So even though the muscles can be very, very strong, there's a case around the muscle that ends up as a tendon at each end, and if that's too long, then the guts push out, no matter how strong the muscle is, unless you're always contracting, which we can't do all the time.
So with, say, childbirth, and I said, you know, if you have many kids, I mean, it can happen with just one.
It can.
But it stretches a muscle beyond its ability natural ability to spring back.
Yeah, that case around the muscle is very tough stuff, so it's hard to get it to stretch. But over the course of 9 months, it can stretch some. And what I'm doing is sort of tucking that back in. I don't cut the muscle, I'm not injuring the muscle, but I'm tightening it up and making sort of like a corset inside so that the foundation is flat, so everything over it can be flat too. We
talked a little bit earlier, and I went to YouTube, but I actually I saw the surgery. And your point is well taken. I mean, where you're actually not severing the abdominal muscle, you're kind of folding it in and
we're folding it sort of side to side. So we bring the two sides together and tighten it in that direction. With the skin, we're making an incision low and bringing the skin down to tighten it, sort of an up and down direction, so you get to tighten in two directions.
Now, I did see some pretty extreme cases where, you know, it was large volumes of skin and muscle that were completely lax, and it was...
Sure, and you can tighten it pretty well.
Washboard.
Yeah. The thing that really helps determine the outcome is not just how much is being removed, but how that skin that remains behaves. And if there's good elasticity in that skin, then I can tighten it and it will keep that shape.
Now, why is it that some people can get away with weight loss and gain and they seem to spring back? Is this a genetic predisposition?
Yeah, we're all different, yeah. So some people, when they lose the weight, the skin just tightens up. Tends to be more common in younger folks. The older we get, the less we tend to recoil. Also tends to be common if someone has had one child as opposed to two. The second one seems to be a little harder.
So it can be a function of age, or
it can be.
Okay. So walk me through, and you know, we're already getting the phone calls. We have a second here, but just who is a good candidate and who is not a good candidate for this type of surgery?
First and foremost, you want someone who's in good health. So good health means either no medical problems or medical problems that are well controlled. So for most folks that I'm operating, they tend to be younger people who've had children. If they've gone through the stress of childbirth, they're probably going to be okay with anesthesia. The other thing we look for is things I can fix. So I look to see if the muscle is loose, to see if the skin is loose, and that there isn't so much fat on the inside. So if someone's still quite overweight and the fat is behind the muscle, I can't get to that, and I can't repair it. I can't tighten it enough.
Now, we need to go to break, but I would imagine you probably combine this with liposuction, or is that
very commonly?
Something that,
yeah, liposuction usually around the flanks. It can help me reduce the size of the scar and certainly complements the procedure. Okay,
we're going to continue our discussion. We have phone calls already coming in. We're going to need to take a quick break. Okay. But for more information about Dr. Mealy, you can call 925-943-6353, or you can check him out on the web at drmealy.com. Let's look at some of the pictures that you brought in. So let's go ahead and roll the first one here. Describe to me what we're looking at.
So someone's had a tummy tuck, and this is somebody who really wasn't overweight, just had a lot of laxity in the muscle and some loose skin that sort of gave a very crepey appearance to the skin.
Nice and tightened up. Let's roll with the other one.
It's another patient. You can see a previous scar from surgery down low there, and also had just loose skin. And if you look at the muscles, we're talking about tightening the muscles. You can see the outside of the muscle, you know, outside on the lateral part before is farther apart than afterwards. So we're able to bring those muscles together.
And we should mention, because there is an incision in the, I guess in the pubic area, it's covered here, but you will have that incision.
Yeah, it's underneath the underwear there.
And usually that will heal or
it heals very well.
Yeah.
It takes time. Of course, it takes about a year for a scar to be completely mature.
Okay, and then our third picture?
This is a third patient who, again, extra skin in the lower part of the abdomen, and this is something that exercise just isn't going to get rid of. There's extra skin, there's some fat still underneath there, but not very much. The main thing is just laxity and looseness.
Okay.
So there's an incision low, and there's also one around the belly button. You can see that again here. There's a little incision up inside the belly button. Because the belly button, it's the same one. We don't actually take it off. We leave it there. We pull the skin over it, kind of like a shade on a window, and then make an incision, bring it back through.
How convenient.
It is.
And
you
this
can see she
last
had a lot of extra skin down underneath. She had lost over 100 pounds on her own. So a lot of what we're looking at there is just skin that's redundant
loose skin.
and wouldn't shrink.
You know what? It looks like from some of our phone calls here, we have questions pertaining to that. Jim from Benicia. Good morning, Jim. You have a quick question for the doctor.
This is Kim from Benicia.
Oh, hi, Kim. Sorry.
Hi, I'm 41 years old.
Yeah.
I've had 4 children, and three of which I had cesareans. One I had natural, and I had appendicitis in between that.
Oh, wow.
I have a lower under my belly button. I have a flab that I can't seem to get rid of.
Yes, if it's confined to just under the belly button, then sometimes a mini tummy tuck is all you need. If it's loose above the belly button, then a formal tummy tuck helps better. And congratulations on 4 children.
All right, thank you very much, Kim. Sorry for mispronouncing it. I think we're going to hold off on the other calls until we go to break here, but that is one of the main questions that Kim was posing about, you know, having 4 children, and then she had an appendectomy on top of that. Would that also undermine any kind of other surgeries? Does that kind of weaken the muscles?
It can. Appendectomy, not as much as some others, because with an appendectomy, we sort of push the muscles apart rather than cutting them. But certainly the vertical incisions that are made for other surgeries, the fen and steel incisions, the low incisions made for C-sections can weaken the muscle, and it's something that can be repaired.
Okay, we're going to take more of the calls, but for more information about Dr. Mealy, you can certainly call him, 925-943-6353, or check him out on the web at drmealy.com.